Now the CDC is getting involved in this tug of war, making the case for schools to reopen. Liza Lucas explains.
Safety obviously a top priority, but the report also talked about the impact on students' mental health. The new CDC report studied fall semester data from schools across the U.S., looking at schools who successfully reopened. Also finding the type of rapid spread frequently seen in nursing homes and workplaces has not been reported in education settings. The report said that keeping schools closed could adversely affect students' academic progress, mental health, and access to essential services. At the same time, the scientists say reopening schools safely is dependent on certain conditions, like controlling the virus's spread within communities. And that could mean some tough decisions. For example, restrictions on indoor dining. Now, when school outbreaks did occur, the CDC cited contributing factors like crowded classrooms and no masks. So the recommendation for face masks and testing and social distancing is critical, plus using hybrid learning when needed. Now again, the CDC report lays out a path forward for schools, but that path forward has conditions.
All right, Liza, thank you.